طيب السلام عليكم. Okay, so I'll talk today in English, and the reason I'm recording this because we have an English-speaking couple and we want to counsel them about the issue of delayed fertility. So I thought it's a good opportunity for us, and they took their agreement. They agreed that we will do this recording. So this couple, they already have a girl, alhamdulillah, but they have been delayed for 5 years. So this means for the past 5 years they're trying to have a baby, and it's not happening. And the lady have irregular period. Irregular period means she's getting her period every 2 months, 2 months, 3 months, 2 months, 2.5, 1.5. So she's not getting her period every month. Other tests that were done, she did not do the dye test, so we don't know about her fallopian tube. And he did a semen analysis somewhere, and it shows that his semen is normal. Now that somewhere is not necessarily a place where we trust, but that's what they've done so far. So I'll start the counseling now. Okay, so number one, we agree that there is a problem.
Yeah.
صح?
There is a problem.
Good. And the evidence is, why are we saying that there is a problem? Based on what?
Based on what? Because maybe actually she is living in India, so she is coming on a visit
on and off basis.
on odd basis.
Right, but the point is, you've been 5 years
Yeah.
trying to have a baby. Now, out of
Yeah.
those 5 years, she was not here in Saudi
Yeah.
Arabia all the time.
Almost, if you calculate the time, she is almost here for 3 years, right?
Yes.
3 years. She's
Right. So out of 5 years, she's been here almost 5 years on and off,
Yeah,
Yes.
on and off.
and she did not conceive.
Yeah,
This means that there is
an issue.
an
problem.
issue,
Yeah.
right? So again, going back, so we agree that there is a problem. You said yes. Based on what? Based on 3 years you're trying to conceive. It's 5 years, but 5 years you're not here in Saudi all the time. You've been on and off.
Yes.
So overall, maybe 3 years, 2.5 years you've been here
Yes.
together, and you
Yes.
did not conceive.
Yes.
This means there is a problem.
Yeah.
What's the problem? How to fix it? How we can help you have a baby? That's a different story.
Sure.
So number one, we agree that there is a problem. Okay, if there is a problem, do you think it's with you or with him? The answer is, it doesn't matter.
It doesn't matter.
You will have babies from him, he will have babies from you.
Yeah.
Okay. Now, when we come to assess the reason of the delay, we have to assess the three components of pregnancy. What are the three components of pregnancy? Egg, sperm, and they meet. Egg, sperm, and they meet. So, egg, we assess the egg by two things. We do your hormonal testing, so we assess your hormones, and we do an ultrasound. This way we can assess the ovary. Where they meet, we do something called HSG, hysterosalpingogram. It's an X-ray that will tell us if the fallopian tubes are open or not. Now remember, you had cesarean section, so maybe, not sure, maybe that your tubes are blocked, or maybe one tube is blocked, right? So we assess your tubes if it's open or not. And how we assess the sperm? By doing semen analysis.
Sure.
But the semen analysis, there are three different types of semen analysis. There is the semen analysis, the regular one, which we call it simple semen analysis, like the one you did. There's something called advanced semen analysis, and there is something called DNA fragmentation. Now, DNA fragmentation is something not related to you. It's for another issue, don't worry about it. Semen analysis gives me 5 information. Advanced semen analysis gives me, so it gives me 11 information. This means the advanced analysis is way more advanced than the simple. In other words, if you fail the simple analysis, you think you will fail or you will pass the advanced? If you fail the simple
Okay.
and you want to do the advanced, you will pass or you will fail?
Of course, fail.
Of course you will fail, because you failed already the
The
simple.
simple.
So there is no point doing the advanced.
Advanced.
But if you pass the simple, is this a guarantee that you will pass the advanced?
Yeah.
No,
Maybe.
no, maybe.
Yeah, maybe.
So it's not a guarantee.
It's not a guarantee.
So if you pass the simple, maybe you pass the advanced, maybe not.
Yeah.
So that's why we will do for you the advanced analysis. This means we will do 3 things. We'll assess the egg, the sperm, where they meet. So we'll do the hormonal testing, we'll do the ultrasound, we'll do the HSG, and we will do the advanced analysis. After that, we meet, and we tell you we found this or that, and your options are 1, 2, 3, 4.
Okay.
You tell me, yeah, okay, I like option number 3. I tell you, okay, but 2 is better. You tell me, I understand, but I want number 3. I will do for you number 3, whatever you decide. Okay?
Okay.
So this is one approach. Okay? Sure. The other approach, just to complete the for people and for you to understand, there are people that comes to me and say, no.
Okay.
No.
Okay.
We're already 5 years after we had our baby, and 3 years together, and we are late, and my semen analysis is good, and I don't think maybe the tubes are blocked. We don't want all of this. We want the strongest way to have a baby. We tell them IVF, in vitro fertilization. So they say, nothing stronger than IVF? We said, no, this is the strongest. They said, okay, we'll go for IVF. Now, there are people that think this way.
Okay.
Now, these people are not wrong, and the other people are not wrong. Everyone choose what's best for them, what they want for them. Some people think, I'm this age, I don't have much time, I'm going out to India, and or my mother is sick, she wants to see my babies, or I have a job, I'm doing my master's degree or my PhD degree after 2 years, I don't have time to wait. So everyone has an issue with their life.
Yeah.
We don't interfere with that.
Sure.
We let the couple decide what they want. So you have basically 2 options to summarize: either to do investigations and then meet, explain the outcome of the investigations, give you options, you choose, we implement.
Sure.
Or boof, some people go for IVF, which is not wrong. These are 2 different options. You're following?
Yeah, following.
Okay. Now, just to conclude, especially with your case, because here we have the wife that has irregular period. Irregular period means not those people who are late 1 or 2 or 3 days. Irregular means you get a period every 2 months, 3 months, months and a half. So this means this person is not ovulating every month. She's not producing an egg every month. Now, it's unlikely that she did not produce an egg for 3 years. 3 times 12, that's 36 months. Is it possible 36 months she did not ovulate? No, it's not. It's unlikely.
Yeah.
Out of the 36 months, at least half of them she ovulated. 1/3. 12 months she ovulated, she did not conceive. At least, right?
Yeah.
But some people tell me, listen, we don't want to go through the tunnel of investigations now. I already have a irregular period. This means I'm not ovulating. I did not take any medicine to make me ovulate. Give me medicine, make me ovulate like other people. 1, 2, 3, 4 months, 5 months, 6 months maximum, right? If I don't get pregnant, I will do all the investigations. So this is another approach. So there are 2 types also of, there's another way of thinking. But with this way, we don't know about her tubes. Maybe her tubes are blocked. So some people say, no, don't give me medicine to make me ovulate. What if I take the medicine and my tubes are blocked? What if you give me medicine and the semen husband of my husband is low? First, I want to do the investigations. So this means this is the 3rd option. So now to summarize, in your case, you have 3 options. Either do investigations, meet and discuss, and you choose and we implement, or go for IVF, or try medicine that give you ovulation for a few months. You don't get pregnant, then you'll go back to the investigations and then we meet. Okay. So now the husband here told me, out of the 3 options we gave them, they are thinking to the investigations and then to do IUI, which is intrauterine insemination. Intrauterine insemination, it's from the name. Intra means inside, uterine, the uterus. Insemination, we put the semen. So we take the semen of the husband, we prepare it, and then we inject it into the uterus of the wife. It's called intrauterine insemination. So I just wanted to comment on that. We can do intrauterine insemination for you, but it's better to do the investigation first, because if after investigations, I know. He said, sure. I said, yeah, but you just told me now I want to do investigations and then I want to do IUI.
Yeah.
We don't say that. We say, I want to do investigations and then I want to know my options. Because if we did the investigations and the tubes are blocked, there is no point doing IUI. Because if we inject the semen inside the uterus and the tube are blocked, this means the sperm will never meet the egg.
Okay.
If we do your semen and it's low, we do your semen and it's weak and then we take it and inject it, again the chance of pregnancy is low.
Yeah.
So once you are thinking خلاص, then we go back to the three options. So we don't want to do IVF, we don't want to take medicine to ovulate, you want to do the investigations. So let's do the investigations, and after the result is out, we will sit, we will discuss the findings, we will give you the options, and at that time I'll give you all the options, including doing nothing, or giving you ovulation medication, or doing IUI, or doing IVF. But at that time I can give you percentage of success based on what?
Based on the results.
Based on the results.
Yeah.
So based on the result, I'll give you your options, your success rate with every modality, and then you can choose what's best for you.
Okay, good.
Okay?
Understood. Okay.
Any other questions?
No.
Clear, madam? Clear, yeah, beautiful girl, inti. I have another suggestion. Let me just. I have a way easier suggestion for you. Now you have this girl, right? How old are you? 5 years old?
No, 8 years.
8, mashallah. Okay. And you're hoping to get a boy, maybe because you already have a girl, right?
Yeah, it does not matter.
يعني, it doesn't matter, but يعني, it's nice to have a boy and girl, right?
Yeah.
Okay. I can give you 2 boys, and you give me this girl. I take this girl, she grow with my children, huh? And she play with my children, or you can visit your mom and dad on the weekend, and I give you 2 boys for you. What do you think?
You want to go with the doctor?
Khalas, you didn't see the look in her face. She's smiling, but at the same time she wants to yeah. Yeah, we're joking.
She's
What's your
enjoying.
name? What's her name?
Dina, what's
Give
her
us a name.
Huh? Dina.
Adina.
Adina.
Yes.
Adina. Good girl, Adina. طيب. Okay. Yalla, all the best to you.
Yeah.
Yalla. I did ask him if they have a question now, but then I want to just to say something. After I answer all your questions, you will now be meeting the educators. The educators will explain to you when, where, how, which, why.
Okay.
How much it will cost you, when to start, what to do. For all the 3 options. Either you do investigations, or you go for IVF, or you go for simply medicine to make you ovulate. She will explain to you all these things, and then you take the information, you go home. You think, you make istishara,
Okay.
you decide what you want,
Okay.
you tell us what you want, and we will do it for you.
Sure.
Okay?
Done.
Any question?